Welcome to the HBOT News Network. In today's research rundown, we're going to discuss sudden hearing loss. And in this study, there's an interesting combination of therapies that are looked at separately and then combined. And of course, hyperbaric oxygen therapy would be one of those therapies. And then the oral steroids for the treatment, and the official name is Sudden Sensorineural Hearing Loss in early or late. And so it's looking at, again, one of the important things about hyperbaric oxygen is in an acute situation, we want to get in there as soon as possible. And so the study does compare hyperbaric oxygen alone, and I believe that group is 60. And then, in fact, I'll get the exact number here. It is 60 for hyperbaric oxygen. And then the oral steroid group is 55, and then there's 56 individuals that receive both hyperbaric oxygen and the oral steroid. The conclusion, pretty straightforward, is that hyperbaric oxygen alone gets significantly better results than the oral steroid. And the oral steroid does have some positive indication of improvement. And then when you combine the two, you really get the best of the three groups. So if you have the opportunity to get hyperbaric oxygen, again, sooner than later, and then the oral steroids. And if you can't get it within the 14 days, it also recommends that you still seek out the same therapy. And it may be in a chronic state at that point, which might require more treatments. If you get it in an acute state, it's recommending 5 treatments. At that point, you've gotten a significant improvement. You're not going to get much more improvement at that point, so hopefully your hearing has returned at that point. So if that's the case, hopefully you can get this information to anyone you know that said sudden hearing loss. Seems it's 20 people in 100,000 is what it indicates here. So thank you.